The Conversations on Health Equity online video series is produced by the Health Policy Research Consortium, funded by the National Institute of Minority Health and Health Disparities. Located in Greenbelt, Maryland, under the leadership of our principal investigator, Kwesi Nfume, HPRC conducts policy research on issues related to health inequities throughout the country with a focus on the Mid-Atlantic region. HPRC uses a transdisciplinary research approach to close the gap between policy and science by assessing how current and proposed policies affect various populations. Major research efforts underway include the Health Policy Literacy Study, the Policy Portal, various research papers focusing on behavioral and social sciences, and a cardiovascular disease study focusing on disadvantage in the food, built, and social environment. For more information, visit our website or our social media channels.
Hello, I'm John Sankofa. Welcome to Conversations on Health Equity. Today, I'm delighted to have as our guest Dr. Elmer Huerta, an expert on cancer and health among Latinos, the single largest minority ethnic group in the United States. Dr. Huerta is the director of the Cancer Preventorium, a division of the Washington Cancer Institute at MedStar Washington Hospital Center. Dr. Huerta is a past president of the American Cancer Society and was appointed by President Clinton to the National Cancer Advisory Board. Dr. Huerta hosts Cuidando Su Salud, Taking Care of Your Health, the only nationally syndicated daily radio show that is hosted and produced by a Latino physician in the United States. He also co-hosts Hablemos de Salud, Let's Talk About Health, a nationally syndicated weekly television program on health. Dr. Huerta is president and founder of Prevención, Inc., a nonprofit organization that produces and disseminates health educational material for the Latino community. Dr. Huerta, bienvenido y muchas gracias for being with us today.
Muchas gracias, John. Thank you very much for having me in the show. Thank
Absolutely.
you.
I want to start with terminology because words are so important. And I'm not clear whether or not Latino and Hispanic are terms that could be used interchangeably, or do they mean two different things? Can you help us understand that?
Absolutely, yeah. I think in general, we use it interchangeably, but there are some subtle differences. For example, Hispanic is a term created by the Census Office to indicate people that are coming from different countries in Latin America. Whereas the term Latino comes from Latin and also includes some people who are from Europe, from Portugal, from Spain, from Italy, from the Latin culture. So in general, when we speak here in the United States, we can say Latino or Hispanic for a person who speaks Spanish and has some characteristic like family values and some other characteristics that define the group. In general, we can say Latinos or Hispanics.
Now, I'm thinking too about when we look at Latinos/Hispanics, I think there are subgroups within that. I think there's a danger sometimes in public conversation to think that's a monolithic group. But these are folks from different countries and multiple ethnicities possibly. Can you help us think about that?
Absolutely, John. This is very, very important. For example, I'm from Peru. Okay, you see me? I'm a mestizo. So I'm descendant from Spaniards that went to Peru from Spain and the Indian culture of Peru, the Native Americans, the Incas of Peru. So in Peru, we have, for example, a person by the name Akira Fujimoto. He is Japanese. He has been born in Peru from Japanese parents, but he is a Peruano. He is a Latino person because he speaks Spanish. He now shares the values of the Peruvian culture, and now if he comes to the U.S., you see him, he may be Japanese in his features, but he's Latino in his heart, in his culture. Or you go to Argentina, and you have a person by the name Juan Goldberg. He is a person who came from probably Germany or Poland and went to Argentina. He speaks Spanish, and when he comes to the U.S., you see him on the streets, and you may say, white, yeah, he's white. But when you start talking to him, he is an Argentinian, he's a Latino person. Same thing, you have Juan Perez from the Dominican Republic. He's black in his skin, in his features. He's an African, a Dominican, but he's a Latino too. So Latino, Hispanic is an umbrella. It's not a race. It's an ethnic group composed by people from many different races and are coming from many different countries. What is the common thing? The Spanish language and the family values they share.
Okay. And shortly we're going to come to the topic of cultural competency, because I'm curious whether or not that might play out differently with different ethnic groups or folks who are from perhaps different countries. But before we go there, I wanted to get a bigger picture of how you're thinking about the health challenges that face the Latino community. What are the biggest health challenges that face this population?
If we can summarize the big challenge for health for the Latino people in the United States, I think it's access to care. Not only access in the form of health insurance, according to a Pew Hispanic Institute poll in 2007 before Obamacare, 60% of Latinos had no health insurance in this country. So access is number one, but the second is access with quality. Because there are a lot of places in the United States that have no sensitivity for these people. There are no signs in Spanish, there are no health providers that speak Spanish, and because they are immigrants, even though they may speak English, when the issue that they want to discuss is about their health, they prefer to speak in their native language. So it's access and quality of access, I would say, are two main problems with the Latino community.
Now, I'd like to pause, if I could, at access for a moment, Dr. Huerta, because I'm curious whether or not the access challenge is related to an immigrant not being documented, or do immigrants who are documented or undocumented encounter these access challenges that you're talking about?
It's both.
Okay.
The access problem is for the immigrant community for two reasons. Number one, they may be undocumented. And number two, they, even though they are documented, they come from countries where prevention and health insurance is not something that exists there. So when they come here, they're young, they're strong, and when the employer says, listen, I'm here to offer you some health benefits, but you have to pay this. They say, no, I'm strong. That's money that I'm going to lose. So they waive the opportunity to get health insurance. And also for the Latino people who have been born here, usually they have not finished high school, they're not educated, therefore they don't have jobs who offer them health insurance, therefore they have no access.
So I want to turn then to the health issues and access and quality of care being on your radar for sure. I'm wondering about cancer. I know how much time you have committed, to this important health issue, and I'm wondering, how does cancer play out in the Latino community? Are there unique issues regarding, well, it sounds like issues regarding access to care perhaps, but are there also issues around cultural competency for care? Can you tell us about cancer and the Latino community?
Yes, the cancer issue in the Latino community is very interesting. In terms, for example, of types of cancer that they get, it's the same as the general population of the United States. Breast cancer, prostate cancer, lung cancer, everything is the same.
Similar rates as the general population?
In general. Okay. But you know what? The Latino community, they have much higher rates of those cancers that are related to infections. For example, cervical cancer related to HPV virus. For example, stomach cancer, which is related to the bacteria Helicobacter pylori, and liver cancer, which is related to the chronic infection for the hepatitis B and C viruses. So those cancers are much more frequent. That's one issue regarding cancer. And the other issue regarding this frequency, these statistics, is that Latinos are now having as the first cause of death not heart disease like the general population, but cancer is the number one for them, heart disease is the second. That's one issue. The other issue is that Latinos, even though they have less frequency, less incidence of the common cancers, they have higher mortality. What does it mean? That they usually go late, and by going late, they have less survival.
And that brings me, Dr. Huerta, to prevention and screening. Are there unique challenges in that area for Latino communities? Can you tell me what those barriers or challenges might be?
Yes, in terms of prevention, which is smoking, obesity, which is immunization against HPV viruses, because of the language barrier and because of this access problem they get, they have not much information about prevention in general. And regarding Early detection, I'm talking about colorectal cancer, I'm talking about cervical cancer, breast cancer, same thing. Because of the access problem and because of the lack of services that are sensitive to the Latino community, they usually go late, and therefore the disease is found in a more advanced stage. So I think there are challenges in these two arenas, the prevention and the early detection. Things are improving, though. Actually, after Obamacare came in, we have now data that shows that Latinos, thousands of them, they got insurance. And now we have some data that's showing that they took advantage of the early detection of cancer, especially mammograms.
What do you anticipate may happen if the ACA is repealed or replaced? Do you have concerns of how that may impact access for Latino populations?
Yes, I think one of the main, I would say one of the groups in the United States that really benefited the most from Obamacare was the Latinos. Number one, because the program did a special outreach program in Spanish for them. So that was good for them. And number two, because at least at the beginning, the prices were really affordable. Of course, we know the problems at the end. They increased the prices. A lot of Latinos, they took the insurance and they took advantage of the screening. They liked the preventative services. So I think now that this program is uncertain in its destiny, probably Latinos are going to be also the groups that are going to be most affected by it.
I'm going to move on to talk about cultural competency in just a moment, but I wanted to go back just a second. You mentioned infections, that cancers that were in some way related to infections, such as HPV, were more prevalent among Latino populations. Why is that? Why is that a greater risk factor for that particular population?
We don't know the real causes, but probably is because also in Latin America, for example, the number one cause of mortality due to cancer in Latin America for women is cervical cancer. And in Latin America, the number one cause of death due to cancer for men is stomach cancer. It's completely different than the United States.
Would be breast cancer for women, I think.
That's number 2 or number 3 in some countries.
Lung cancer.
Lung cancer is
rank.
number 3 or number 4 there. Here in the United States, it's number 1 because of smoking. So statistics are very different. So we think that because Latinos came here by the millions, bringing the HPV, maybe bringing the Helicobacter pylori infections, or they had hepatitis C or hepatitis B in their home countries, is that they're developing this kind of infection-related cancers here.
That's very interesting. So I do want to turn now to cultural and linguistic competency. We hear this term a lot in the healthcare field. And if you could help us understand what is cultural competency or cultural and linguistic competency, and why is it especially important for Latinos?
That's a very good question. For example, just let me put you an example that I see in my clinic. In my clinic at the Cancer Preventorium, once in a while, I diagnose cancer. Okay? So cultural and linguistic competence. Cultural means that when I find the cancer in one person and I ask them to come to my office to explain the diagnosis, the whole family comes. The whole family is the mother, the father. I have 10 people there because the whole family, they want to know that is cultural. And I have to acknowledge that, and I have to recognize that all of them are there.
And that's more unique to the Latino community, isn't it?
Whereas when that happens with the Anglo community here in the United States, for example, the patient goes sometimes by themselves, or maybe with a husband, that's it. Because in the US, we are individualistic, whereas the Latinos are family-oriented, they are collectivistic. That's cultural. And then when I talk to them, sometimes they say, Dr. Huerta, please, tell my mother that she has cancer, but don't be so harsh, please. And I have to acknowledge that. That's a cultural competence. And linguistically means that I have to speak to them in Spanish, because that's how they understand, even though they may be bilingual. But they prefer to speak in Spanish when a serious threat to their health comes on. So cultural means that you need to relate to the culture in many different ways. And linguistically means that you have to speak in the language they prefer. For example, I get a lot of patients in my clinic said, Dr. Huerta, I have insurance, and I went to see this doctor, and they found cancer. They call at home at 9 p.m. to tell me that I have cancer over the telephone. That's not culturally sensitive.
Absolutely. Yeah. We hear the term patient navigators. These are these healthcare personnel or staffers who can help patients kind of find their way through the healthcare system. To your knowledge, are patient navigators being trained in cultural competency so that they could provide these services for Latinos or for other ethnic groups?
Absolutely. Navigators, they are. My very good friend, Dr. Harold Freeman in New York, he is the person who is behind this movement of health navigators, and he has an institute, and one of the main things they provide is this cultural competence, and for Latinos or for a bilingual person, this strong issue of talking their language. Yes, they must be trained in both cultural and linguistic competence.
Dr. Huerta, thank you for that. So access and quality of care plays such an important role, obviously, in the health status for Latino populations. As we wind down this first segment, I look forward to the second segment when we can talk about health education and health communication for those communities, which I know is very important to you. Thank you very much, Dr. Huerta.
Thank you very much, John. Thank you.